It stems from this idea that massage therapy has to hurt. They have to feel like their muscles are being worked on, they're being kneaded and twisted into a pretzel.
No
That's,
pain.
yeah, exactly. The whole no pain, no gain, but it's not necessary. The reality is that when we're doing a lot of this work, especially when we're dealing with hypersensitivity, we're not necessarily trying to manipulate and to break down and to beat up muscle. It's really just working with the nervous system, creating that element of relaxation, call it stimulation of the parasympathetic nervous system, the rest and digest. Using gentle techniques, especially slower, easing in techniques, can actually have a really huge impact on decreasing that hypersensitivity.
Today we're diving into a powerful but often overlooked tool for managing IBS, visceral hypersensitivity, and constipation. That is abdominal massage. And to help us explore this topic, I'm thrilled to introduce Benedict, aka Benny, San Juan. Let's get into our discussion today.
All right. Hello, Benny. Welcome to the show.
Hi, Lee. Thanks for having me.
Yeah. Just to get started, why don't you just give us a little bit of background on yourself, who you are, where you work, currently what you do.
So my name is Benedict San Juan. Everyone just calls me Benny, and I'm a registered massage therapist. I've been practicing for about 10 years now here in Ontario. I actually work out of a small clinic called Heal Space. It's sort of our one-stop shop for anything injury and health related. So there's myself, we have Dr. Ricky Singh, he's our chiropractor, as well as Dr. Cameron Bosny, our sports medicine doctor. So it's a small shop, but what's great about it is that the three of us get to collaborate together, work together in order to help people through a multitude of different conditions and things like that. Aside from my work there, I also work as an instructor, a college instructor. So I teach like anatomy, physiology, and I also supervise student clinics as the students massage members in the public in preparation to become massage therapists.
Awesome. Yeah. And Heal Space is a great clinic. I know they've helped me with different running related conditions over the past couple of years, which is awesome. And it's always good to have, like, I know you have your specialty, but to be able to like collaborate and then refer to other practitioners, just, you know, if there's maybe something that you can help with, or they can refer back to you. So it's always nice to work in that interdisciplinary space as well.
Absolutely.
Yeah. And just in terms of like the conditions that you work with and with your patients, or can you sort of explain like who you treat, who you see?
Mm-hmm. So I've worked with a wide variety of different people and populations. A lot of people sort of see us primarily as working with athletes, amateur, professional, whether it's like rugby or weightlifting, runners, but we sort of expand beyond that. One population or one group of people that I do a lot of work with is actually, I do a lot of prenatal massage. So I work with a lot of clients that are pregnant, that are going through the stages of pregnancy. There's a lot of value in massage therapy for people that are going through the stages of pregnancy. So I do a lot of work there as well. Even people that are not necessarily like physically active, desk workers, we try to treat everyone because everyone has, you know, either they are concerned about a specific issue or they want to prevent injuries from happening. So we like to be part of that entire spectrum.
Mm-hmm. Yeah, awesome. And then I guess getting into the topic of today's episode. So talking a bit more about abdominal massage, is that something that you work with often? And can you also explain a little bit more about what that is? And then we can get into it.
Yeah. So abdominal massage is something that I personally enjoy doing. But a lot of people can have some apprehension when it comes to receiving abdominal massage. I could talk a little bit more about that later on. But abdominal massage has a lot of benefits. The first one is when we look at the abdominal region, well, we have muscles there. You know, we have the abdominal muscles. You know, we have rectus abdominis, the six pack, but we also have all these smaller muscles that are so important for movement, for protecting our core, our back, for example, like our oblique muscles, transverse abdominis. So working on those muscles, they can sometimes be neglected. And especially when we're looking at active populations or someone that has, you know, is going through pregnancy or is neonatal, there's a lot of benefit to that as well. So we have massage therapy for the muscular side of things. Less common is massage for conditions like constipation. So I've been doing a little bit of that recently. As I mentioned, I've been treating clients that are pregnant, and constipation during pregnancy is actually quite common. A lot of people don't realize that. And so there is value in using abdominal massage in order to help them deal with some of these symptoms of constipation. Another group that I've been working with are actually cancer patients. So I think something around like 60 to 70% of cancer patients that are receiving treatment may experience constipation symptoms. And so providing abdominal massage to help them manage those symptoms can actually be quite beneficial for them. So the use of abdominal massage there's a lot of indications or uses for it. It's just a shame because, a lot of people are apprehensive about having their stomach, their abdominal region touched or worked on. So sometimes it's a bit of a tricky sell to get them on board with the idea of having it done.
Mm-hmm. But yeah, especially in those conditions, and also just with constipation, like you may develop a lot of tension in that area, sometimes always tightening, or I know for I have clients with IBS or IBD, they do experience maybe flatulence, gas that can be quite uncomfortable, and they're always sort of maybe tensing their abdomen, especially if they're experiencing pain too, and then that can cause, I think, even the abdominal muscles to become tight, and then our intestine is muscle. So, we have digestive organs that are muscles too, so even those can become tight. And I think just working on that area, obviously the whole body is important, but giving that area some attention and helping it relax then can help with symptoms too.
Yeah.
What got you interested in abdominal massage? Does it relate to you personally, or is just an area that you saw that more patients were asking for, or?
Mm-hmm. To become a massage therapist in Ontario, you have to go through 2 years of schooling. And as part of the curriculum, we actually learn about abdominal massage. Usually, massage therapists will learn a little bit about it, just enough to pass the board exams. And one of those tools that they rarely reach for in their toolbox. That included myself. That wasn't until I actually tore, or I experienced a muscular strain of one of my hip flexor muscles, the psoas. And that's a muscle that's in the abdominal region. It's quite deep. And having work done by another massage therapist and a chiropractor in that region, first of all, it was not the most comfortable thing. I don't know if you've ever experienced feeling that. Yeah, it's spicy. But after experiencing that, after going through that in order to help with the muscle strain, I immediately saw the value in myself, and I started to get a little bit more interested in it. So brushed up my textbooks, got back to practicing, slowly started to incorporate that a little bit in my practice. And then a couple of years ago, I actually saw an influx of clients coming in for prenatal massage. And so with that, between, clients dealing with hip flexor or abdominal muscular related conditions and clients that are going through pregnancy, I started to get a lot of hands-on experience doing abdominal massage, and just sort of went from there.
Oh, wow. Okay. And did you find the patients responded really well in terms of, I guess, managing the constipation, just getting things moving and going, or what's sort of
There was definitely apprehension. I know, especially when I had clients that would mention constipation or IBS, they might say, oh, my physiotherapist recommended me, or doctor suggested that I try this, or I saw a video on YouTube that said that there's massage for it. So there's definitely interest, but of course there's also that apprehension associated with it. The apprehension of having someone touch, what can be a sensitive area, but also that fear or perhaps that embarrassment of any reactions that might happen, whether that's passing gas or flatulence on the table, or suddenly have to go to the washroom. But the thing is that these are very normal responses, totally normal. So part of my job is also to communicate what the expectations are, what might actually happen during the massage, and what we can do when something happens. So for example, if someone who's constipated is coming in and I do this work, well, do we have a game plan if they suddenly need to use the washroom? So I communicate all of this, reassure them this is totally normal, and that if they suddenly need to get up and go, we have a process just to make it as smooth as possible for them. So between reassuring them, explaining the benefits, and showing them the process, it's a bit of a sell, but they slowly start to warm up to the idea and then they get on board.
Yeah. So just making them feel comfortable. And obviously you've worked with lots of patients with this, so you've seen different reactions, and just letting people know that it's okay if, their digestive system responds, which is what you want in a sense, to get things moving and get things, moving through. I know with IBS too, like a lot of patients do have visceral hypersensitivity, which is that like increased sensation of pain in the deep organs, like our visceral organs. So definitely like with the intestinal tract and in the abdominal area, like they can have a lot of like sensitivity. But it's also been shown that like abdominal massage specifically can help with visceral hypersensitivity symptoms. So I think some patients, in addition to like being embarrassed to have symptoms during the treatment, I think for some of them, they may be worried that there would be like a lot of pressure and it could cause more pain by, I guess, working on that area. So how do you sort of work with patients who maybe have visceral hypersensitivity? And it could occur, I think, too, with endometriosis is another common one, like GI conditions. But how do you sort of work with patients so that there's like a bit of pressure that works for them, that you're getting a response, but it's not too much that it causes pain or discomfort?
It's definitely a big concern that a lot of people have. And I think part of it stems from this idea that massage therapy has to hurt. They have to feel like their muscles are being worked on, they're being kneaded and twisted into a pretzel. Yeah, exactly. The whole no pain, no gain. But it's not necessary. The reality is that when we're doing a lot of this work, especially when we're dealing with hypersensitivity, we're not necessarily trying to manipulate and to break down and to beat up muscle. It's really just working with the nervous system, creating that element of relaxation, call it stimulation of the parasympathetic nervous system, the rest and digest. Using gentle techniques, especially slower easing in techniques, can actually have a really huge impact on decreasing that hypersensitivity. And it may not necessarily feel like much for a lot of people. The pressure is incredibly light. The movements are slow. There's no pain or ideally no pain or discomfort. But sometimes that gentle approach can actually have a huge impact in dealing with that hypersensitivity. And, again, when part of my job is to communicate these things, to explain that this is what the process would look like, and this is how I might be able to help them. When they have that reassurance, when they understand what the process is all about, it's easier for them to come around to it.
Mm-hmm. Yeah. I can see too how maybe, I think probably doing it in small doses, like they may get benefit from one treatment, but I feel like probably multiple treatments over time of just getting that little bit of work done in the area and then leaving, sort of like retraining the nervous system to be able to like comfortably respond to that treatment. I think over time I can see how it would definitely probably get easier, and then again help like reduce that visceral hypersensitivity, which is some disconnect with the organs in the brain that's sending like a sort of an altered pain response. But I think it definitely helps.
Yeah. And I think that's an important point as well, is that managing the dose, not necessarily going, okay, we're going to do a 1 hour massage of just your abdominal region. Yeah. It's unrealistic. I would rather use that appointment time, whether it's like 60 minutes or 90 minutes, to work on the entire body and allocate, 5, maybe 10 minutes into that abdominal region. That way we do have that overall sense of relaxation where I'm introducing my touch to them in a more predictable manner, like working on their back, their neck, their shoulders, decreasing stress that way first before I start to make my way down. And not only am I using massage techniques, but I'm also applying some breathing techniques. So some people may not be aware of their breathing patterns. So talking about like diaphragmatic breathing and even working on some of the muscles of respiration just to help them, be a bit more in tune with how they're breathing. So when we start incorporating the diaphragmatic breathing, that nice belly breath in combination with these massage techniques, it can really help with their relaxation as well as managing that hypersensitivity.
Mm-hmm. Definitely, yeah. Diaphragmatic breathing it's a good one. Even just doing 1 or 2 minutes. Like I have a lot of clients do that even before eating meals, or if they are experiencing an increase in symptoms, just it helps to actually sort of turn on that parasympathetic response going. And yeah, I think with the idea of the small doses over time, that's sort of a common theme amongst things in health, even like, sports, etc. Like you don't just go out if you want to run a marathon, you don't just go out and start running 7 days a week. Like you're not a runner, little doses a few times a week, and then you slowly build up over time. It's the same with treatments like this, like sort of working it over time, because you don't want to overdo it, because then, it's not going to feel good and you're not going to want to come back, but sort of building it up over time. Can you walk us through, just start to finish, what does a typical treatment look like that would incorporate abdominal massage? Let's say for like a new patient who's coming in with IBS, they've experienced a lot of abdominal discomfort, pain, some gas. What would a session look like?
So a good chunk that helps this process is the initial intake, that communication. So someone comes in for an appointment, they've filled out their health history form. So I have a general idea of what they're coming in for, but they go into the room and we start having a bit of a conversation. I want to know a little bit about what it is that they're coming in for and why. Sometimes people might be coming in. So if we're talking about a patient with IBS, perhaps they may have been referred to me by another healthcare professional. Perhaps they may have been referred to me by you, for example. So I want to know, well, how did we come to this conclusion? How did we determine that it's IBS and that how massage can be helpful for them? So part of that is also asking questions about their health. Are there any potential risks or contraindications I should be made aware of? What are their symptoms like? And so as I go through this process of asking these questions, it helps me to get a better sense of their overall health, their condition, things that I should be looking for, and how I can create treatments or modify a treatment based on their needs. Someone that is dealing with IBS and they've been experiencing symptoms for, 10 years and they have other health conditions. So for example, like they might have like high blood pressure or they might be taking certain types of medications for chronic pain. Their treatment is going to look very different compared to someone who is recently diagnosed with IBS and they're physically active in great health. So knowing where they're coming from can help make the treatment more effective. After going through that, I might go through a very quick assessment just to get a sense of how their body moves, because there might be some other factors involved, whether it's like restricted range of motion through their spine, or perhaps weakness or tightness within muscles in like the hips or the abdominal region that could be associated with it. So knowing all these things can also help me determine, okay, what are the secondary things that I want to work on in conjunction. After all that's been done, sort of have an idea of what the game plan is going to be, and I'll communicate what it is I want to do, the areas I want to work on, the techniques that I want to use. Sometimes people may have questions about these techniques, especially if it's a technique that they're not used to, or they may not be comfortable with it. Some people are not comfortable with exposing their abdominal or their belly area or having someone touch it. So communicating what it is I want to do, as opposed to just kind of like going in there and rubbing that area up, is important. I want to make sure that they're on board with it. I want to make sure that I have their consent, especially if I want to use some different techniques. Later on, I'll probably talk about the use of contrast, so hot and cold exposure, to help with constipation. And that's something that I can actually use, in my practice, or I might give it to them in self-care. So explaining all this ahead of time so they know what to expect can help them be on board with it, as well as to be better prepared. After all that's done, I'll get them on the table, and then that's where the hands-on stuff actually happens. Usually I don't go right away and start massaging the abdominal region. I want to, introduce my touch. I want to get them comfortable, relaxed first. So if that means working on their back, working on their neck or their shoulder, the classical Swedish massage techniques, just to get them a little bit more relaxed, I think that's a really good starting point. At some point, I might talk about breathing, maybe introduce diaphragmatic breathing as an exercise during the massage, especially if I'm about to work on the abdominal region. I don't want them to suddenly start doing the shallow breathing through the chest. Afterwards, I'll spend a little bit of time working the abdominal region. If I'm working with them for the first time, I'm going to keep it short, 2-3 minutes, 5 minutes max. That way I have the opportunity to work everywhere else around the body to help further that relaxation. And then after the massage, We may do some self-care, give them a couple of exercises to help, further the treatments or things they can do on their own at home, talk about strategies or further treatments, or perhaps even referring them out. If this is something that I might not be able to help them with, I could potentially refer them out to another healthcare professional that might be better suited for their needs. So during that hour, I try to squeeze a lot of stuff in, but the idea is that I want to make sure that what I'm doing is effective, it's safe, and that they understand and are on board with that game plan.
Awesome. Cool. And typically, do you recommend frequency of treatments or when to come back?
The short answer is it depends. There's a lot of factors that we have to consider. The first one is how their body responds to the treatments. Someone that responds very well, we see immediate results, or they go home in the next couple of days, they feel amazing. We may not necessarily have to do very frequently. It might be every 4, 6, or 8 weeks, especially if I give them some self-care exercises and he knows that they're effective, or if they're working with another healthcare professional. So let's say they're working with yourself, they're working with a registered dietitian. And so perhaps my role in all this could just be in symptom management. So it's one of those, if they're feeling great, they're feeling great. And then suddenly start to have that 1 week where they're experiencing a flare up or they're starting to feel a little bloated, then they can come in. So it really comes down to a lot of factors based on how they're feeling, how their body responded to massage, and whether or not they're working with other healthcare professionals and how I can sort of collaborate and fit in with them. Generally, though, what I would suggest for someone who is experiencing chronic IBS, if we can make it a consistent habit, 6 to 8 weeks, maybe even a bit more frequently, and see if there is noticeable lasting change, then perhaps in the future we can sort of spread it out. But I think a massage every 4 to 8 weeks is a good starting point for a lot of people.
Yeah, definitely. Yeah. I mean, it always comes down to resources and, what people can commit to, but they ideally like that 4-week mark just to make sure the tension isn't building up. And like we said, building small doses that could help with visceral sensitivity, I think would be a good approach. But I do recommend when clients are feeling good for a while and then experiencing a flare up, it can be helpful to get in and get an abdominal massage, also full body massage, just to help reduce that tension and stress.
Yeah.
Helpful more one is preventative and prehab, but then also if they are going through something, just to help nip it in the bud earlier.
Exactly.
Yeah, I want to go back to your approach though. It sounds very, very personalized, very thorough. I know I haven't done a massage with you, but I've been to other massage therapists. It's usually to go in and tell them, what areas to focus on and then massage and it's done. But it sounds like you really go through that full assessment just to understand what's going on with their medical history, how they're moving, maybe where there's imbalances, and then really tailor the treatment to them. And then not only, I guess, the physical massage, but you also bring in some other treatments, modalities as well. Can you talk a little bit more just about the hot cold therapy?
Yeah. Sometimes an hour of massage may not be the most effective use of my time and may not be effective for my client. So it's important for me to, after learning about their health history and doing an assessment, trying to figure out, okay, what is the best approach? Sometimes the best approach is introducing other modalities. One of the ones that I use, especially when it comes to constipation, is hydrotherapy, or the use of hot and cold. One of the ones that I like to use, especially for myself, is it's called contrast therapy. So I'll expose my stomach, my abdominal region to a hot stimulus for a couple of minutes, and I'll switch to a cold, and I'll just keep alternating between them. It's not necessarily the most pleasant experience, but it's definitely very, very effective. I traveled to Mexico recently, and for some reason, my body does not respond well to flying. I mean, I'm an anxious flyer already, so that doesn't help. But whenever I fly, I do experience bloating, constipation, all those symptoms. So it takes me a couple of days to adjust. And so one of the things that I'll do, I'm in the hotel room, I've got the hot towel, I've got the cold towel. So what it looks like for myself is I'll get a hot towel. So whether it's soaking in water, pop it in a microwave, or use a tea kettle to warm up the water, I'll place it on my stomach for about 5 to 10 minutes. and then I'll cover that with a dry towel just to help create an insulating barrier.
Mhm.
After the 5 to 10 minutes, I'll take it off, and I'll have a cold towel. So same thing, the towel's wet, probably soaking in like ice cold water, and then I'll expose it for 30 seconds to a minute. Immediately take it off, repeat the process. Usually I'll do that for about 3 to 5 rounds, and I've noticed that can be quite helpful for myself. It's something that I also use in my clinic. In my clinic, it's probably easier because I do have access to the heating blankets and all the towels that I need versus traveling where I sort of have to improvise.
Yeah.
But it is a very effective technique, and it's something that I also recommend to people as part of their self-care.
Do we know why, or how that works, or sort of
So one of the things that when we expose tissue to heat after several minutes, they start to experience one, there's vasodilation, which is the relaxation of blood vessels in order to mitigate the heat, but there's also the relaxation effect of it. So to go from sudden relaxation to everything suddenly tightening, we're sort of stimulating a little bit of that peristalsis, especially in the intestines. And so when everything's opening, things suddenly closing, or relaxing and tightening, and we do that a few times over, it can be quite helpful in stimulating that movement, that peristalsis, so that the food or the chyme in the intestines can start to move along through.
Right. Okay. So it sort of helps get that motility going through the digestive organs, so that in turn that will help with bloating and constipation.
Exactly.
So, I guess, does it work? Would it be the same with doing a hot bath and then a cold plunge? I guess it's just an easier option if you don't have access to either of those.
Yeah, it can definitely, it's the same concept. The main difference though is that taking a hot shower and then a cold shower, it's a bit more unpleasant because it's hitting your entire body. But let's say you're in a hotel, you don't have very many towels, or there's no kettle handy, then yeah, absolutely, have a hot shower. You can direct the shower head onto the abdominal region if you want for 5 minutes, immediately turn the tap to cold, and then just keep repeating that over and over as long as it's tolerable.
Interesting. Yeah, it definitely isn't too comfortable, but I think the cold exposure, cold showers, cold plunge are sort of that good stress. It doesn't feel good, but there are benefits to it. Usually you feel good afterwards. But that's interesting. I didn't think of it as a way to stimulate motility. So that's a good one, actually. I think a lot of people will maybe try that out next time they travel. And it is common with flying just because there's reduced air pressure in the cabin, and then your intestinal muscles contract, and that slows down motility, and then you can also get more dehydrated, all the things. So, do you also use any forms of acupuncture currently in practice?
Not currently, but I'm actually starting my acupuncture certification course next week. So I'm hoping come summertime, I should be able to incorporate that into my practice. But it's definitely something that I would love to be able to incorporate, just given how easy it is to, quickly insert a few needles and leave it in there for, a minute or two. Sometimes that can be more effective than me trying to knead and massage for 5-10 minutes.
Cool. Okay. And then I did want to ask, do you use visceral manipulation at all in your practice? And if you want to explain a little bit more about what that is and maybe what the difference is between general massage therapy.
Yeah. So visceral manipulation is another modality that can be used. It's a very fascinating technique because it uses a combination of both mechanical direct techniques, so the actual physical manipulation of tissue, as well as what's known as the reflexive or indirect techniques, so how the body responds to the stimulus. So by working on the viscera within the abdominal region, it can help to stimulate or to relax certain things. It's not something that I see very common here in Ontario, though. I only know of a handful of massage therapists that are certified in visceral manipulation. I'm not one of them. I would love to learn a little bit more, in a couple of years' time. But the few massage therapists that do use it, they seem to have a lot of success when it comes to dealing with certain chronic conditions, whether it's with IBS, even managing certain levels of stress. For some people, they hold a lot of stress in the abdominal region, and so the visceral manipulation can be incredible in just allowing things to relax.
Mm-hmm. Yeah, it's an interesting concept. I don't know if I fully understand it, but what I gathered is that it essentially can help reduce tension, like in the visceral organs, so like liver, stomach, like intestinal muscles. And then if there maybe are sometimes, this is what someone explained to me, but like shifted slightly out of place, then that can be contributing to symptoms. And then the treatment of it may help move them around a little bit. I think it's similar to the TCM acupuncture, where we don't know exactly like how it works, but it seems to show that it works and people get relief from it. So it's sort of in that realm, I guess. But, yeah, it is interesting. I think like there is a demand for, I've seen like good responses in terms of like IBS patients and seeing some benefit from that. And I guess it goes a little bit deeper, like just in the visceral organs than general like massage working on the muscles too. So
yeah, and it's definitely, I myself don't necessarily know too much about the physiological effects of what happens during visceral massage. But it's one of those things where if I have a client that my work isn't quite effective, or they've been seeing other healthcare professionals and it's not quite working, then I would refer them out and I would say, hey, this is something you could try as well. I think the risks associated with it are incredibly low. The big risk is soreness, maybe potentially a bit of bruising, but it's one of those, try it. If it works for you, amazing.
Yeah, absolutely. And then in terms of abdominal massage, is there anyone that should caution getting abdominal massage, or that maybe wouldn't be a good candidate for it? Or
So there are a couple of contraindications that we look out for. One of the things is that if we have someone that has IBS or has another condition, so for example, like Crohn's disease, massage can be helpful there. But if they're suddenly experiencing an acute flare-up, if the area is more tender than usual, or there's heat or anything like that, we generally avoid working on that area during an acute flare-up. And it has happened once in a while where someone books an appointment, they're explaining that they had a weekend where they ate something or they were doing things, and they suddenly experience a flare-up and they want some work done. And unfortunately, just because of the acute nature of it, massage isn't necessarily safe or indicated in that moment. So part of this comes down to asking questions, doing the assessment. So someone who is in an acute flare-up, I would typically suggest that they wait a little bit before coming in for that kind of work.
Okay.
Other things would be, checking in to make sure. So let's say they are dealing with, with a chronic health condition, perhaps it might be in their best interest to check in with their family doctor or their, the healthcare professional they're working with. They might say something like, massage might not be safe right now, or may not be effective for you right now. So having that check-in just to make sure that there aren't any potential, risks or contraindications, it can be, that can be quite important. And I think a big one would be if the person doesn't want it. There are times where someone will say, oh yeah, my doctor referred me, so I'm here, but you can tell they're not really on board. Yeah. And if I, try to explain to the process to them and suddenly they're like not really feeling it, it's important to have that conversation to make sure that they're on board. And if they're not, I'm not going to do that work. I don't want to force them to do anything they are not comfortable doing.
Yeah, that makes sense. Yeah, I guess going back to the flare up, that's a good point. Like if it's maybe the first day they're experiencing it and there's a lot of discomfort there and it's sort of like reaching its peak.
Mm-hmm.
You're saying don't book in on that day. Maybe give it a couple days to see, make sure it's like trending down, calming down a little bit, and then it would be a good time to get in. Like once it's kind of reduced, I guess the severity of the discomfort has been reduced a little bit, and it seems like it's calming down would be a much better timing. That's what you're saying.
Yeah, absolutely. And again, it can depend on the condition and the individual, but as a general rule of thumb, like during an acute flare-up, I may not necessarily do direct work there. I might do some work elsewhere just to, help with the relaxation, encourage diaphragmatic breathing, get them into that rest and digest. But perhaps direct work may not be right in that moment.
Right. Okay. I guess it would depend too on your schedule. Like probably not everyone is able to book in the same day because you book up. But I guess if they did and they were to come in, then it's important for patients to remember to be like honest with you and let you know exactly what's going on so that you're able to then tailor the treatment to work best for them. And if they are feeling like an acute flare in that area, then like you said, you'll work on the other areas, maybe do some breathing to help things calm down, but save that area for another time, another treatment.
Exactly.
Yeah, that's awesome. Okay, cool. I guess other questions I had were just, I think you had mentioned some of them, but do you ever give those clients like exercises they can do at home, like self-massage or any tools or I guess protocols to take away that they?
Mm-hmm. So I think the three most common ones that I keep in my toolbox that I like to give to people. The first one is the ILU or I love you massage. That one is fairly common. I like introducing it because it's such a gentle technique, something that almost anyone can do at home. So that's one of them. The second is the use of the contrast, so the hot-cold exposure. It takes a little bit more to set up because you need to have, multiple towels and you need to have hot, you need to have cold. It's also not particularly comfortable, so some people don't like that. And then the third one is that diaphragmatic breathing, talking about the use of the diaphragm, especially because the diaphragm is just so large and encompasses a large area there that it's important for encouraging that relaxing breath, as well as taking away some of the pressure from, the typical breathing muscles like, pectoralis minor. So those are definitely three that I like to give regularly for people that are dealing with constipation or IBS or things like that.
Mm-hmm. You usually just tell them to use it as needed, or would you give them like a frequency, how often to do it, or?
Yeah, absolutely. We were talking earlier about the dose of treatment, and I think that knowing the dose of the self-care is also important. Techniques like diaphragmatic breathing, that's something that I think everyone should be doing often. I like to use it, especially after a long day. I lie down in bed and it just sort of helps me to relax, unwind, and helps me to fall asleep. The hydrotherapy, though, that one I would probably space out a little bit. One, because it takes a little bit to set up. Two, it's a bit intense and uncomfortable for some people. And depending on their health status, the exposure might be a bit too intense. So I might suggest that they only do it, every few days, versus someone who is, younger, healthy, no health concerns. Then they can do it on a more frequent basis. For myself, whenever I'm traveling and I do experience the bloating, I'll do 3 to 5 rounds of it, and I'll do it once a day for the first few days. Usually that's enough, and it starts to go away from there. And the I love you massage, the self massage. Well, again, it's a very gentle technique. It's not aggressive, and so I'm able to use that a little bit more frequently. Sometimes I would suggest that that they can do it multiple times throughout the day, as needed, based on their symptoms, based on how they're feeling. A lot of people find it to be a relaxing technique as well. So sometimes I'll give it to people just to help them to relax at the end of the day. So using the self-massage in combination with the diaphragmatic breathing.
Oh, okay. Yeah, I can I'm gonna try that later. Sounds like it would be very relaxing. Cool. And then, yeah, I guess if someone isn't in the Toronto area and can't come see you at Healspace, is there a way that maybe they can find someone else who specializes in abdominal massage? And I guess to that point, like I feel like it's still not that common. Like I know that the clinics that I've been to, I think maybe out of like 12 practitioners there, one of them did abdominal massage. So is there like a database where RMTs are registered that they specialize in this, or how can someone maybe find an RMT that does abdominal massage in their area?
It is a bit tricky to find massage therapists that have that experience and are comfortable doing that. The first step would be to check within their current healthcare support network to see, if they have a physiotherapist, maybe they can ask, hey, do you know a massage therapist that can do this? Or, any other healthcare professional that they might be working with. Sometimes having that referral network can be, a really good first step. If that doesn't work, Google can be an alternative. It is tricky though to find them. So searching up, massage therapist Toronto, and then using those keywords, whether it's constipation, IBS, visceral massage, things like that can be helpful. But I usually would suggest, having that referral network, especially if that, healthcare professional has personal or professional experience with the person that they are, that they're referring to. I think that can be very helpful.
Yeah, I think it's always good to get referrals that way, like a good option to choose. I mean, there's probably maybe some people that might not jive with you or don't have the actual practical experience of doing it all the time, although they may list it as something that they did the training but not work with it all the time. So I think, definitely asking for referral can always be helpful. First step.
Yeah.
Save you some time, like searching through Google, which can be difficult too. I guess, that was a lot there to take away. And I think people listening probably will have a lot of light bulb moments and be very intrigued to now try abdominal massage. I guess to take it away, do you have any final thoughts or anything else want to add that we didn't cover, or the other thoughts?
Let me see if my notes. I think on my notes we pretty much covered everything. I think it's one of those things that everyone should try it. Whenever we think about like a full body relaxation massage, we think back, neck, shoulder, head, arms, legs. Some people incorporate glutes, but we're missing this whole area right here. So even if you're, you may not be experiencing any issues with constipation or IBS or anything like that, but as part of that whole body treatment, feeling that connection of the upper and lower part of your body, there's a lot of value in getting abdominal massage done. There's a lot of structures there that could benefit from touch. We all, myself included, we all love, back, neck, shoulders, but, there's more to the body than that. So I think that it's something that everyone should try it at least once, just to get a better sense of their awareness of their body, where they hold tension. They might be surprised to, with what they feel or what they notice during that massage.
Yeah, that was a good takeaway. I guess we also say your gut health impacts your overall health. So maybe massage your gut area can help reduce tension in the rest of the body too. So that makes sense for sure. So how can someone get in touch with you if they do want to book? And do you offer any resources or any more information? Yeah, just for those listening today.
Yeah. So you can find me on Instagram at rmt.benny. You can also find my clinic, which is Healspace at Healspace. We're just over at Queen and Ossington, so right downtown. And after this, I've got it in the works, and I'm going to be working on a video on how to do the I Love You self massage, both like over clothes as well as under clothes if somebody wants to do directly skin to skin contact type of thing. It's a very simple, very gentle technique that I think that be worth exploring. So I'm definitely going to make a video on that on my Instagram page too.
Cool. Awesome. Okay. Well, I have those links to your Instagram. I'll put the video up when it's ready, and then the link to the HealSpace website. And I think you guys are pretty flexible with some weekend appointments, weekdays, evenings. So if someone is maybe, not directly in Toronto, they could find a time if they're sort of in the area, make a trip to Toronto and book in.
Yeah, exactly. Like I'm in the clinic typically on Saturdays, so it's the perfect opportunity. Come on down, get a massage, then afterwards do a little bit of shopping on Ossington. There's a lot to see and do there.
Yeah, lots of coffee shops, restaurants around there. It's a good spot.
Exactly.
And accessible by TTC. So
that's right. Yeah.
Cool. Awesome. Well, thanks so much, Benny. This has been a great chat. Lots of things to think about. I know I've taken some things away. I think the hot cold therapy for motility and helping with bloating and constipation is something that was not on my radar. So definitely taking that away. And I hope those who listened are definitely interested, and now we'll see more of the value in abdominal massage and how that can work into their specific treatment plan as well. All right. Thanks so much, everyone, and take care. Bye for now.